Good afternoon, Dr. Berger.
Good afternoon, Irina.
Yesterday you touched on exercise physiology a little bit. Can you be a little more specific? What do you do when you work out?
So yesterday I talked about some of the benefits for the length of life, the quality of life, blood sugar control, avoiding falls, and so forth. Today let's talk a little bit about some specifics. So in strength training in particular, which is what I'd like to focus on, there are 6 cardinal movements. So there's push, there's pull, there's to twist, there's lunge, squat, and deadlift. So these 6 cardinal movements, you can do them with free weights or machines. So press might be bench press to push. You might row for pull. You might do a chop for your twisting. Deadlift and squat, those are pretty self-explanatory. Lunge you can do with or without weights as well. But it can also be really important to put in functional exercises, because we don't do these movements in an isolated way in daily life. If you want to lift a suitcase up over your head and put it into the luggage compartment on the airplane, that requires a couple of different movements. You're going to twist, you're going to push. So things like farmer carries, for example, where you have a kettlebell in one hand, are helpful in terms of mimicking carrying the suitcase. You might do a kettlebell inverted in one arm, which would be helpful to push the suitcase into the overhead compartment. Just as an example, you can do planks, you can do, of course, wall squats, push-ups. There are a whole variety of functional exercises that you can do. So strength training, really important. You have those 6 cardinal movements of push, pull, twist, lunge, squat, and deadlift, which you can do with free weights, with machines, or some sort of functional exercise that really mimics the movement of things we do in daily life.
Do you use any kind of apps?
So what I do is actually I work with our exercise physiologist, Peter, to develop a plan. And I log this manually, but there are many good apps that you can work with to track your progress. He also has an app that he utilizes to show the exercises in terms of video, and you can log them there as well. So many options. So we are Northeast Medical Practice, located in Great Neck, New York on Long Island. I'm Dr. William Berger. If you'd like to reach out to us, 516-604-3418, northeastmedicalpractice.com, or find us on all the social media platforms, or check out our podcast, Longevity MD, on Spotify. Everything I give you in these videos is for educational purposes only. No doctor-patient relationship has been formed, and if you have specific concerns, questions for your own health, please don't hesitate to reach out to your medical professional. But until we see each other next time, be in good health.
Thank you.